PICC line dressing changes are important to prevent external infection. The PICC line dressing should be changed within the first 24 hours of insertion and assessed for the accumulation of blood, fluid, or moisture under the dressing. After the first 24 hours, the frequency of dressing change is every 7 days, or PRN, for dressings that are damp, loosened, or soiled. The supplies needed for this procedure are a central line dressing change tray, a stat lock, and some clean gloves. This is when you should look at the patient's access device and see if there are any signs or symptoms of complications. This is also a good time to explain the procedure to the patient. Mr. Martin, today our plan is to remove your old dressing that's been on for 7 days. We're then going to clean the exit site of where it goes into your skin. We're also going to measure and see how long the external length is. We're going to put on a new dressing and then flush your PICC line. That should take about 10 minutes. Do you have any questions?
No, I do not.
Perfect. So now I'm going to wash my hands, which is a very important step. I'm going to wait for this to dry. Then I'm going to put on some clean gloves. How are you doing, Mr. Martin? Okay?
I'm doing well.
Perfect. So once my clean gloves are on, we're going to remove the old dressing starting from distal to proximal end. Sorry if you have hair, this might hurt a little bit. Now we need to be careful not to tug on the catheter because we don't want it to come out at all, okay? I'm sorry, Mr. Martin, this will just take a second. And we're going to discard of it. We're also going to take off the stat lock. Want to hold on to that, make sure it doesn't go anywhere. Perfect. And we're going to discard of this. Now this is a good time to assess for any redness or swelling or exudate around the exit site, which is right there. And I don't see anything, it looks fine. And now this would be a great time to assess the external length of the catheter to see if it's migrated at all.
So I am going to be measuring the external portion of this PICC line. So the first thing you want to do is you want to don sterile gloves and you want to have a mask on as well. If your patient wants to look at what you're doing, then you can have them don a mask as well, or you can have them look away in the other direction. Mr. Martin, if you could please look away in the other direction, and there we go. So what we're going to do is we're going to take a look at the notch marks at the insertion site. And you can see they're little black dots that are 1 centimeter apart. So if we look at the insertion site, there's 1, 2, 3, 4 centimeters out is what his is measuring at. So what you would do is you would check with the patient's chart to make sure that this matches what has already been documented since the PICC line was inserted. If it is a different centimeter than what has already been charted, then there could be a possible migration of the PICC line. So you would want to go on with that and make sure that you take the necessary nursing interventions. The next part is you want to measure 10 centimeters up from the insertion site. So here's 10 centimeters, and what you're going to do is you're going to measure their circumference of their arm. So Mr. Martin, if you could lift up your arm for me. And he is measuring about 34.5 centimeters. So you would check to also make sure that this matches with what is in the patient's chart.
So now that we've donned our sterile gloves and have on our mask, we're going to clean the insertion site where the PICC line goes into the skin. So we're going to use our alcohol swab stick that's on our sterile field. We're going to start at the insertion site and spiral out for about 2 centimeters in diameter. You want to remember not to go back to the insertion site with the same swab stick because you can get bacteria in there. Then we're going to discard it. When that is complete, you can use your chlorhexidine prep to clean the rest of the skin. You can also clean the catheter port, but you want to remember not to go back to the insertion site. And try to avoid tugging on the catheter at all times. Now it's important to let that dry and don't wave your hands on it or blow on it, because some people do that and that's not what you're supposed to do. When that's dry, you also have some skin prep to use around the skin. The skin prep is used under the tegaderm, which helps it stay on. And you can put that wherever the tegaderm is going to go. Let that set for a little bit. You can also use this right here, which adds some security to the line. You want to make sure you do one at a time, one side at a time, because it's really sticky. And you can put that depending on where your exit site is. You can either put it above your exit site or below to stabilize it. And I'm going to put it below, right here. And as you can see, it's very sticky. Before we put on our tegaderm dressing, we're also going to attach our stat lock. And it goes on as such. And you want to lock it down before you take off the back portion. You're then going to take off like this, one side at a time. And it's stabilized right there, so there's no migration. When that's complete, you can then take your tegaderm dressing and you want to make it so it covers the exit site, the stat lock, and the wires right down there. Then you're going to carefully secure it down onto the skin. How are you doing, Mr. Martin? Okay?
I'm good.
Perfect. I'm going to make sure it's down completely. You can also use some extra sterile tape in your sterile dressing kit to secure it down if needed. Just add some right here to keep it secure. Now it's also important to write your initials and the date on here so they know the next dressing change is going to be. So I'll put it right here, easily visible. And then when this is complete, you need to make sure you document the whole procedure in the patient's chart.
So now what we're going to do is we're going to show you how to flush the PICC line catheter. This is done to maintain patency and to also prevent mixing of medications and or solutions. So the three things you're going to need is you're going to need to don some clean gloves, and you're also going to need an alcohol swab and a 10 cc normal saline flush. The PICC line is only capable of taking 25 psi. So if you decide to take a 3 cc syringe and try to flush the PICC line, that's going to generate to 45 psi, and that will potentially rupture the line. So by using the 10 cc syringe, that only generates 7 psi, and that greatly reduces the chance of the line getting ruptured. So the first thing you're going to do is you're going to take your alcohol swab, and you're going to clean both the top portion and the surrounding edges of your PICC line for about 20 to 30 seconds. And we'll pretend like I've done it for about 30 seconds. Then open up the saline, and you're going to expel the air bubbles so you don't get any in the line. And so you're going to attach it right on top. And it's very important that you use a push-pause motion when you are flushing the PICC line. This creates turbulence in the catheter, and it helps keep the catheter clean and prevents occlusion of blood or medication residue. And then you would remove the saline flush, and that is how you flush a PICC line catheter.